You take a sip of ice water, or bite into ice cream, and suddenly, sharp pain shoots through your teeth. Why are teeth so sensitive to cold? And more importantly, what can you do about it? In this video, we'll uncover the science behind tooth sensitivity, the surprising causes, the hidden triggers, and the steps you can take to finally stop wincing at every cold drink. Stay until the end, because I'll share the one treatment most people overlook that can actually rebuild your enamel. So what's really happening when your teeth hurt from cold? It comes down to dentin hypersensitivity. Under the hard enamel is dentin, a softer layer filled with tiny tubes. These tubes connect directly to the nerves inside your tooth. When enamel gets thin, or gums recede, those tubes get exposed. Cold liquid reaches the nerves, and you feel that sharp pain. So sensitivity isn't about weak teeth, it's about nerves being exposed. Now, what makes dentin exposed? Several everyday habits. Brushing too hard. It scrubs away enamel and pushes gums back. Acidic foods and drinks, soda, citrus, wine, erode enamel over time. Gum recession, often from gum disease, exposes tooth roots. Tooth grinding, usually at night, wears down enamel. And whitening products, when overused, can temporarily increase sensitivity. That sharp pain isn't random. It's a warning sign. Enamel is the shield of your teeth. It's the hardest substance in your body, but once it wears down, it doesn't grow back. That's why enamel loss is the leading cause of sensitivity. And here's the twist. Enamel doesn't usually disappear overnight. It wears down slowly, year after year, from small daily habits. Preventing sensitivity starts with protecting enamel every single day. Here's another big cause: gum recession. When gums pull back, the root of the tooth is exposed, and roots aren't protected by enamel. They're only covered by a thin layer called cementum. That's why cold drinks hit exposed roots so hard. Gum recession can be caused by gum disease, aggressive brushing, or even genetics, and once roots are exposed, sensitivity becomes almost unavoidable. Cold isn't the only trigger. Sweet foods, hot drinks, even a breath of cold air can cause pain. And sometimes, tooth sensitivity isn't about enamel or gums at all. It could be a cracked tooth, a cavity, or a failing filling. That's why ignoring sensitivity is dangerous. It might be a small problem, or the sign of something much bigger. So what can you do right now? Switch to a soft bristled toothbrush. Brush gently. Use toothpaste for sensitivity. These block the tiny tubes in dentin, reducing pain. Avoid acidic foods and drinks, or rinse with water right after. Don't brush right after acidic drinks. Wait 30 minutes. Enamel is softer right after acid exposure. And if you grind your teeth at night, wear a night guard. These changes can make a big difference in just weeks. But what if sensitivity doesn't go away? Dentists have treatments that go beyond toothpaste. Fluoride varnishes strengthen enamel. Bonding agents seal exposed dentin. Gum grafts cover exposed roots. And in extreme cases, root canals stop pain completely. Here's what most people miss. Professional fluoride treatments can actually help rebuild weakened enamel, something store products can't fully do. So why are teeth so sensitive to cold drinks? It's usually exposed dentin from worn enamel or receding gums. Sometimes it's cavities or cracks. The good news? With the right habits and treatments, sensitivity can be reduced or even stopped. So don't suffer in silence. Protect your enamel, care for your gums, and talk to your dentist if it doesn't improve. If you found this helpful, subscribe for more clear science-based dental tips.